Let's talk a little bit about plantar fasciitis. So plantar fasciitis is often described as a sharp pain that starts in the heel along the inside part of your foot. So the bottom of your foot, we'll call the plantar aspect, going into the heel. And it's often a real sharp pain that comes on when you get out of bed. So that first step as you get out of bed, you get a sharp burning pain. Really limits what you do and generally will warm up as the day goes on. This is a very chronic condition in many cases and can take anywhere between 3 months to even a year to fully resolve. And in that time, a lot of folks will come to see me and they'll talk about all the other things that they've tried. Many of us in the medical community will talk to patients about adding on anti-inflammatories like ibuprofen, Motrin, naproxen, Aleve. And in some cases, we'll talk about using orthotic devices, so adding more foot support when you're walking around during the day. And in some cases, talking to folks about putting on one of those splints that you wear at night, also known as an anterior or posterior night splint. Physical therapy can also be utilized to increase load management and hopefully improve mobility so that patients can get back to what they need to do. If we're at the 4-5 month mark of your pain, it's unlikely that this is just going to get better on its own. This is usually when we start talking about a chronic irritated process like plantar fasciopathy as opposed to plantar fasciitis, which is more degenerative versus inflammatory. And this is generally where regenerative treatments such as dextrose prolotherapy or platelet-rich plasma can be very helpful in that both can stimulate a pro-inflammatory state to jumpstart or kickstart that recovery process. Now, it doesn't work quickly in the same way that a corticosteroid injection will, but in the long run, so when we're talking about 4 to 5 months after, we are seeing a lot more response and usually sustained relief.